Doctor's Dilemma, written by George Bernard Shaw. George Bernard Shaw published this drama called The Doctor's Dilemma in 1911 during the time when the partition of Bengal was repealed. In this drama, George Bernard Shaw uh, both undermines and reinforces a rounded view of the good doctor. The play introduces one character, Sir Ralph Bloomfield Bonington, cheering, reassuring, healing by the mere incompatibility with his welcome presence. Even broken bones, it is said, have been known to unite at the sound of his voice. Sir Ralph, simply known as BB, is kindly but sadly deficient in medical knowledge. The play's physician protagonist, Sir Colenso Ridgion, is able to murder the husband of the woman by referring him to BB for anti-tuberculosis treatment. If BB gives the mistaken impression that no that one can have competence or bedside manner but never both, Shaw sets the reader straight in his preface. He makes clear by savagely attacking their absence that both scientific acumen and compassion are necessary qualities of the good doctor. Shaw includes under science both a clear understanding of biological mechanisms and the statistical study of outcomes, placing him in synchrony with today's evidence based medicine. He also devotes nearly a quarter of his preface to attacking vivisection because he thinks that a profession that would justify the torture of animals can be trusted to treat humans compassionately. Shaw sees huge deficiencies in both science and compassion compassion in the medical practice of his day, but he does not blame doctors. Hello, Shantaranam. Hello, how are you? Good doctors must practice within a good system, free of perverse incentives that push wildly beyond the ascertained strain which human nature will bear. A good doctor would tell the idle rich patient that I'm also fine. What about you? Uh, he, a good doctor would tell the idle rich patient not a bottle of medicine, but Shaw quotes Dr. John Aberthin, who was born in 1764 and died in 1831, to live on sixpence a day and earn it. A good doctor would tell the poor patient that she needs for good health not a bottle of medicine, but decent housing, clothing, and food, good air to breathe. We are reading a great drama. It's a problem play. It's called The Doctor's Dilemma, written by George Bernard Shaw, the Nobel laureate for literature, an Irish dramatist and world famous, and a host of other things she is quite unable to obtain. In both cases, doctors who are paid for providing drugs and who must compete with their fellows to attract patients would soon face poverty if they gave some sound advice. Besides poverty that affected a good portion of the profession in the early 1900s, saw as inhumane the demands on the doctor to be available for emergencies at all hours of day or night. Shaw's solution was a government finance system in which doctors were paid a salary to promote prevention and public health. Returning today, Shaw might be pleased with how we had solved the problems of doctors' poverty and working hours. He might argue that we still have a long way to go in the science and compassion line, especially because he thought that a truly scientific and compassionate attitude would naturally breed humility, a virtue he might find in as short supply in today's medicine as in his own time. So, this is simply all about the doctor's dilemma. And if we want to talk more about the doctor's dilemma, the Doctor's Dilemma is a play by George Bernard Shaw, first staged in 1906, just after the partition of Bengal in Bangladesh or India or Pakistan. It was published in 1909. It is a problem play about the moral dilemmas created by limited medical resources, conflicts between demands of private medicine as a business and a vocation. And this drama was premiered on 20 November 1906 and it was premiered in Royal Court Theatre, London. The language is English and the subject of this drama, The Doctor's Dilemma, is a doctor must decide who will receive a scarce life-saving treatment, and the genre of this drama is a problem play and the setting is a doctor's consulting room, an artist studio. So there are some vital characters. Mr. Denny, Sir Patrick Cullen, Louis Dewburn, Amy, Dr. Brenkichop, Millenwall, and there are some other. The Doctor's Dilemma uh, is a very problem play, and this drama has revealed the 1900s doctors' deficiency of knowledge and compassion, lack of compassion for the patients. And at the time, the dramatist Dr. G.B. Shaw had tried to unravel the problems existent in medical profession. There's a lot of significance of this drama. Just we will talk about the significance. The play mentions then during the time of G.B. Shaw or George Bernard Shaw. এক ফোঁটা চোখের জল, আসসালামু আলাইকুম ভাই, কেমন আছেন? আলহামদুলিল্লাহ ভালো আছি। The play also mentions new developments in the germ theory of disease, namely obscenines, and included socialist and anti-vivisectionist viewpoints. The theme of the play remains current in any time. আমি হ্যাঁ, মোখলেস ভাই কেমন আছেন? ভালো আছি। আমরা লাইভটা অবশ্য আজকে দ্রুতই শেষ করব। আপনি অনেকদিন পরে সংযুক্ত হলেন। আশা রাখি ভালো আছেন। এই ড্রামাটা নিয়ে পরে আমরা বাংলায় কথা বলবো। এটা একটা জর্জ বার্নার্ড শয়ের বিখ্যাত নাটক আর কি, ডাক্তারি পেশা নিয়ে। তো দ্য থিম অফ দ্য প্লে রিমেইনস কারেন্ট ইন এনি টাইম, and there will be treatments that are so scarce or costly that some people can have them while others cannot. Who is to decide, and on which grounds is the decision to be taken? It is timeless. It is sometimes claimed that an expected side effect of the play's success was to greatly increase the popularity of the first name Jennifer, the name of the main female protagonist in the English-speaking world. However, UK government statistics covering England and Wales only show the name Jennifer first entering the top 100 most commonly used names for baby girls in 1934, a full 28 years after it was first staged. Similarly, the name did not enter the top 1000 names for newborn US girls until 1938. So, this is simply all about the drama, The Doctor's Dilemma, a problem play by George Bernard Shaw. পরের ক্লাসে, পরের লাইভে, মোখলেস ভাই আশা রাখি আপনি ভালো আছেন। পরের লাইভে আমরা এটা নিয়ে একটু বিস্তারিত আলোচনা করব যে সালে 1906 সালে এটা প্রথম মঞ্চায়িত হয়, আর 1909 সালে প্রকাশিত হয়, আর 1906 সালে এটা প্রথম প্রিমিয়ার হয়। তো এই নাটকটা বর্তমান আধুনিক চিকিৎসাবিদ্যার সাথে সেই সময়ের চিকিৎসাবিদ্যা বর্তমান চিকিৎসাবিদ্যা কতটুকু উন্নত হয়েছে এবং অবনত হয়েছে সেই বিষয়টা নিয়ে আমরা আলোচনা করব। তো সবাই ভালো থাকবেন, পারলে চ্যানেলটি সাবস্ক্রাইব করবেন। এরকম এই চ্যানেলে সব শিক্ষামূলক বিষয় নিয়ে আমরা আলোচনা করি। তো আজকের মতো এতটুকুই। সবাই ভালো থাকেন, সুস্থ থাকেন। আসসালামু আলাইকুম রহমতুল্লাহ।